welcome to South First. I am Chetna Valgrave. Today we are with the heartbeat of Jayadeva Hospital. He's stepping down after 17 years of long serving as director of Jayadeva Hospital. So we welcome you, sir, Dr CN Manjunath.
Thank you very much.
Sir, your first thoughts on the day you're stepping down after 17 long years, and I've noted down it's over 8 lakh procedures, 75 lakh outpatient visits, and then around 60,000 surgeries which you yourself have done out of this. What are your thoughts today, sir, as you step down?
It's quite a satisfying day because I never thought I could reach what I have reached this height today. So when I took over this institution as a director in 2006, it was always my dream that I should be able to turn this hospital into a center of excellence, and also it was my dream that we should able to show the nation that a government hospital can function like a 5-star corporate hospital and still should able to provide a quality cardiac care at an affordable cost to the cross section of the society. So in this direction, I have fully achieved what I dreamt way back in 2006, and also we have nurtured a great talent, and also we have inculcated this discipline of service and commitment among the workers, because one of the biggest challenge is to really manage the manpower, because mindset of each person is different. So there is a quality. I mean, if you look at the healthcare scenario, there are some institutions where there is charity, but there is no quality. And there are some institutions there is charity, but there is no quality. And other way around, quality, but there is no charity. But here we have a very good mix of both quality and charity. So that gives a lot of satisfaction. And at the same time, we have taken this affordable cardiac healthcare to the other parts of Karnataka. We have set up a world-class 400-bedded cardiac facility at Mysore. And also within Bangalore campus itself, main campus, Infosys Foundation, led by Sudha Murthy and Inar Narayan Murthy, has built and gifted a 350-bedded hospital. So under Jayadeva umbrella, across 3 campuses, we have close to 2,000 cardiac beds. So that makes it one of the largest healthcare destination. But most important is a common man is getting a quality care irrespective of financial affordability. So that we could able to make up, and all successive governments are really supporting us, and they are really acknowledging whatever proposals we have sent. But hand in hand, the donors are really playing a big part in promoting the healthcare services so that a needy patient gets a correct and quality care. So these are some of the things. And another important thing is we are running country's biggest super specialty course in DM cardiology as well as in cardiac surgery. So in last 17 years, we have produced nearly 350 cardiologists for the state as well as for the country. So because as a result, what is happening, and a lot of these trained cardiologists are moving to tier 2 cities. As a result, timely treatment for needy patient is being done in some of the semi-urban
Yes.
India.
Yes. So you have, like you rightly said, you have ensured that this is like a 5-star corporate hospital. It's no less than a 5-star corporate hospital, definitely. Were there some of the major challenges? What were some of the major challenges in this last 17 years?
Yeah, one of the major challenges initially we took over, the first one was because building and equipment alone cannot deliver services. So what is really required is a very good workplace wellness and very good working atmosphere, and we have to build a very team concept itself. So that I could able to inculcate a very good working atmosphere.
Was there any particular message which you told the staff that this should be here, or whether you told the government that this should be given to me to ensure that this comes out all?
Yeah, first of all, we improved the first contact person's public relations. So we should be courteous, and you should never say no to any patient. We should be able to coordinate and communicate. So we built up a very strong communication and a receptive channel in this sense. And at the same time, the finances financial position was not good in that time. During 2006, we had some Woodco loans, plus the corpus was very very fragile. So what I suggested to my employees at that time, it was only 425 employees were there. Today it is 3,500. So we have virtually recorded 500% growth in last 17 years. So I appeal to all my employees, let us donate our one day salary to the institute corpus fund. Then let us start asking other cash rich organization in the government sector, and also we'll approach the donors, because I strongly believe charity should start at home. So that's how we are built. And there were also some cases between the employees and the institute. So again, appeal to them, you withdraw all those cases, we'll sort out here itself. So that created a sort of a excellent working atmosphere, and from then onwards we started moving in the right direction. And because we improved our quality of services, then we strengthened our operation theaters, we strengthened our cardiac cath lab, and we also started one master health checkup unit, so that we could able to because unless you attract elite class, rich class, then you may not get a cross subsidy. So I think then slowly the trust was established. Of course, today a common man strongly, everybody believes that if they go to Jayadeva Hospital, irrespective of their financial status, they get a timely treatment.
Yes, you had this motto of treatment first,
Yeah.
Payment next.
Next.
So this is a challenge to actually keep it up, isn't it?
Yeah, that's correct. Because nowadays, see, nearly 45 to 50 permanent donors are there to this organization. Permanent donors. And if you calculate one-time donors, it is somewhere around 325. So that is one. And we have built up a strong poor patient corpus fund, which is nearly 150 crores now. And we have got also equally strong donation fund, which is 50 crores. The interest generated, we give it to the poor patients. See, another thing, we are also, established a very strong infrastructure. So, in fact, we added the additional new OPD. We have master checkup area. Then we have echocardiography units. See, see, the problem is, although it's a huge volume, because one of the biggest challenges is 98% of patients come without appointments. So we have to see every one of them. So parallelly, I expanded. We created more OPD units, we created more echoes, we expanded the laboratory. Although our outpatient footfall is somewhere around 1,700 to 2,000, by 5 o'clock, all patients get their reports, OPD reports, whether it is ECG, X-ray, echo, treadmill test, or even for that matter, some nuclear scans, CT angiograms. So I think this is how we could able to rope in, all cadres of patients.
I think
So-
your expansion to two-tier cities also has made a lot of difference. Like you always kept saying, whenever the budget is passed, or whenever you always kept saying, everybody need not come to Bangalore.
Correct.
It becomes a burden. So, what is your take on the two-tier?
Yeah, I think because we thought we should take this affordable cardiac healthcare unit to revenue divisions, because it's not possible to establish in every district or in every small places. Then weight of the branches will pull down the mother unit. So what we did was we established. So it was decided that we should have Jayadeva cardiology branches in revenue divisions. Mysore revenue division, it takes care of 5-6 districts. Then we established Jayadeva Hospital in Kalburgi, that is taking care of 5 to 6 districts. So now another Jayadeva branch has just, of course, construction has just started about 6 months back in Hubli, Belgaum division at Hubli as the center. So probably we are covering the entire state. So, and we have got all types of facilities, advanced cardiac facilities, advanced cardiac surgery facilities. So whatever the newer devices that have come, newer technology, we have adopted everything actually. So
it's like a teenager you're handing it over, because you have started, the baby was born with your
Correct.
thing. Now it's like a teenager whom you're handing it over to an institute now for the incoming, whoever is coming in next. What is your message to that person?
Well,
whoever
anyway,
comes in?
most important, whatever the credibility, whatever the trust we have built in, whatever the quality of service, that should be sustained. So that's where both in terms of our interpersonal relationship among the employees and the same system should be continued so that people continues to get benefited out of it.
Is there anything which you actually could not do and you would want the person
See,
to do?
our new Jayadeva Hospital complex, 371 new Jayadeva Hospital complex at Kalburgi, 90% of the work is completed at this point of time. So it was at the back of my mind. It should have been completed, or I should have been there for another couple of months, because it's likely to be completed and functional by April and May. Anyway, I think it should be on the board.
Are you upset with the government for not extending at
No,
least
no.
for the next few
No,
months?
I'm not at all upset with the government at all. So it's the decision of the governing council and all. And so, in fact, I'm very thankful to all the successive governments, all the chief ministers, all the medical education minister. One of the greatest thing that has happened is we had a good rapport with bureaucracy. So those bureaucracy, whether it is, we had a very dynamic finance secretary, S.N. Prasad. Then we had very good health secretaries, presently Javed Akhtar, and earlier one Umesh was there. Then I think all those badges, Sidaya, then I think Vittal, so many people have helped, and so I'm not at all upset with the
So all the
government.
news reports which are claiming that you're upset with the government is
No, I'm not. Only thing is, I should have completed that project. That's all. So no question of being upset. See, many times all these things may be a blessing in disguise. Also, we don't know. Many times, so-called bit of unpleasant things can turn out into great opportunities. We don't know.
So what is the next opportunity you're talking about? So is there anything in
No.
the
I
pipeline?
think my passion is my cardiology, and I will continue to practice in some hospitals, and that's it. So I should thank even other people who have, because we should never forget the ladder. When we climb some floors. Dr. D. Chinnai is the founder director of this place, and we started as a small unit in Victoria Hospital Complex. Then we had a successive directors. So they've all contributed in their own way. But if somebody to start this concept of autonomous institute, they might have also had a lot of challenges this way. And we should be very thankful to all my employees, because it's not one man show. Although I have given a leadership, I have taken a lot of initiatives, I have adopted a lot of innovative methods, like for the example, incentive scheme has been introduced first time in this thing. And also, of course, anybody coming to emergency, whether money, no money, documents, no document, insurance, no insurance, they're all admitted and treated. So we are truly, literally following treatment first, payment next concept. And life is more important than the file. Humanity is priority on those lines. And we have a very strong the faculty also. They all believe that they belong to this organization. So
are you contesting elections for the next round from JDS? That is
no, it's all speculation. Okay, so I have not thought over all those things at this point of time.
But are you interested?
No, my first passion is cardiology.
Okay.
So anyway, I should thank my family also. My wife has supported, but for that great family, because I have made Jayadeva as my first home. Second home was where we live. So I think all those sacrifices to be remembered. So I have to thank all my colleagues, all employees, because they are the real bricks and mortar of this organization.
Thank you very much, Dr. Manjunath. It was wonderful speaking to you. Wish you all the best for your future. Thank you very much.